Other ethnic minority backgrounds are more likely to die from COVID-19 than white people. Figures released by the Office of National Statistics show black men and women are 4 times more likely to die after being diagnosed with COVID-19 than those who are white. The risk of death is also significantly higher for men and women of Bangladeshi, Pakistani or Indian origin. Well, the report says such people have been disproportionately affected by underlying health conditions and economic disadvantages. Shadim Hussain is a British government advisor and board member of the Bradford Foundation Trust. He joins us by Skype from Bradford in the United Kingdom. Good to have you with us. One thing which is kind of interesting about this report, although it does say that some of these ethnic groups, they suffer from disadvantaged circumstances, it says that even after taking that into account, there is still a disparity in the death rate. Why?
Sami, thank you for having us. Yeah, absolutely. I mean, this is something that has been reported previously, and at long last, everyone is in agreement that minority communities are disproportionately affected. One of the reasons why is we know that in the NHS in the UK, for example, around 1/3 of the frontline staff are from BAME communities. We also know that a high percentage of BAME communities work in job roles that are customer-facing, and this has a high level of interaction and brings about the risks. And of course, you've already mentioned the socioeconomic disadvantage, the pre-existing health conditions, the multi-generational households. I guess, I mean, when you combine all this together, it really is a recipe for disaster.
Should more resources be then put into place to, in minority areas, or what's the solution, do you think?
Well, I mean, we've known for many years here that across the UK, particularly in the BME communities, black minority ethnic communities, the inner city areas are highly congested. The properties and the health inequalities, the education inequalities. There's many such factors that bring us to a situation across the UK that further investment needs to be made by the government. Now, we know that the government has announced an investigation into health inequalities, but it's very important that they empower local communities to be able to deliver change for themselves.
Does any of this help in finding a vaccine, especially the parts of this report that might have something to do with genetics?
I mean, there's obviously ongoing research, and it's important that we also learn from what's gone on in other parts of the world. I know from the research that is going on, it's not a quick process to get to a vaccine. However, the important thing that we must look at is how can we ensure that going forward these types of inequalities are addressed, and we ensure that those that are from these minority communities are part of that research too, to try to investigate and ensure that there's a very real risk that we could have a second round, as being mentioned previously. And significant investment needs to go in to find a vaccine, hopefully.
All right, thank you very much for your thoughts on that, Shadim Hussain.